We're here the morning of surgery with Gary. How are you?
Good, thank you.
Good.
Very
So,
good.
Gary, you are 70.
Yes,
And what are we planning for you today?
we're going to do the deep plane facelift and neck lift, the lower eyelid surgery, the brow lift, and the rhinoplasty.
You nailed it. Yep, so we're doing neck lift. There'll be some shape changes underneath. You were pointing out a little bit of fullness on one side, it's not present on the other side.
Correct.
Some gland fullness we'll be repositioning and shrinking. A little bit of looseness in the face that rides into the neck. When we treat all that, I'm going to finish the job up into the temple. And then we're doing the under eye bags.
Yes.
But importantly, we're going to leave some skin on the upper lids. We're not going to just get that razor crisp.
Correct.
We had a discussion about that. What are your feelings on that?
I feel like that's very important that I wouldn't look too overdone, and it would be age appropriate, and it would leave me looking more natural for my age.
Yeah. So I think that's a really good decision. In a lot of men, we'll treat the heaviness on the brow, but maybe not get a super crisp platform where your eyeshadow would go if you're treating a female patient.
Right.
Or maybe like
And some people do have that real heavy area above the eye, but I don't have that.
Yeah, and actually, men, you think of George Clooney, you think of Pierce Brosnan. It actually is very attractive in a lot of men to have a little bit of an extra fold or a little bit of a feature there.
I agree.
And now we're doing your nose.
Correct.
Have you had previous nasal surgery?
Never.
Okay, so and you're 70.
Yes.
How long have you been considering treating your nose?
Really, it started coming into my mind when I started researching the facelift and the neck lift, and I started looking at the pictures, and it just seems like it would fit into the whole plan of what I'm doing. It really, I started thinking about it when I started thinking about the facelift.
Yeah. So one of my favorite things to do is to kind of finish the portrait, so to speak. And so I do a lot of noses on people that had either thought about it when they were younger and circumstances weren't right, and then it comes around time to their face. That's usually one combination nose I do. And the other one's like this. Well, I'm doing everything else, and it's an easy recovery to do at the same time, so I want to get kind of everything in balance. So thank you for letting everyone kind of see what you look like ahead of time.
Absolutely. Glad to do it.
For me, a future male facelift patient, I want to say thank you for being out here, because that's one of the comments I get all the time. I wish we saw more men. I'd like to see a man's perspective. So thank you very much.
You're welcome. Glad to do it.
Well, it's the first morning after surgery with Mr. Gary. How are you?
I'm good.
Good. Well, for if you didn't see yesterday our interview, we did a deep neck lift, deep plane facelift, lower lids. We did a little different version than we usually do. Brow lift and a rhinoplasty. How was your first evening?
I was kind of sleepless and sore for the first half of the night, and the second half of the night I just went off and slept like a baby.
Good. Well, that's unusual. The sleepless is pretty common. The first few days, anesthesia typically makes your sleep weird. Sleeping well the second half of the night is fantastic. I'm happy.
Yeah, they gave me a Lorazepam.
Yeah, lorazepam.
Or Lorazepam. Yeah, so
good.
that really helped.
I forgot to mention Gary's 70. Gary didn't look 70 before we got a hold of him, and I'm going to tell you what, you're going to look younger than I am. Contours-wise, for sure, younger than I am within 2 to 3 weeks.
Dr. Nyack has been telling me it turned out well, so I'm really excited.
Yeah. So Gary had some specific challenges. He had, like I do, big glands. I have them right here. You don't anymore. Your jawline.
Yeah, and I had the bands.
Yes.
Which I hated.
Heavy platysmal bands.
Yes.
So those are gone.
Yeah.
The under eye bags. Gary has no fat. He is my hero. He has literally no abdominal fat. No subcutaneous fat.
But I had the bags under my eyes.
He did have
fat
bags.
I hated those too.
Yeah. So instead of a fat transfer, which I usually do, get rid of the fat bags and use fat from elsewhere to build under the eyes and also the cheek area, that kind of stuff. He had no viable fat, so we did a fat transposition. So we took the fat bags from under his eyes and brought them forward into the hollows immediately under the eyes, and that's what those little anchors are. The stitches with the anchoring gauze. We'll remove that at about the 1 week mark. So it's kind of recycling.
And you just thought of that while you were doing it.
Well, it's an alternative. A lot of people use that as their primary. It's typically not my primary because I'm usually doing fat transfer in other parts of the face as well. And it's actually just more efficient to remove the fat bags and transfer into the emptiness, but I'm also usually doing transfer in other places where that fat bag isn't voluminous enough or it doesn't have enough reach to do everything all at once. So since I'm usually doing a subtraction of 1 and an addition of 4, I'm getting the extra from other places. This was a 1 and 1, and we didn't put fat in any other part of your face, so it worked out well.
Right. You just needed it there.
Yes.
Yeah. Got it.
The other thing that he's got that's a little unusual is he's got supporting sutures in his lower lid. So if you look right now, his eyes aren't as open as they were before the surgery. Swelling does that, but this is also, there's buddy taping. It's like when you sprain one finger and you tape it to the next finger to help support it. I've kind of buddy sutured his lower lid up to the upper lid because I expected this swelling. You can see you're pretty puffy under the eyes.
Yeah, I am.
So for the first 5 days or so, we're using this temporary temporal tarsorrhaphy suture to help support the lower lids during the healing process. Pain-wise, how you doing?
Pain-wise isn't bad. I mean, it's soreness more than I would call it than pain.
Yeah.
Yeah.
And you took the Tylenol?
Yes.
You took the Celebrex, which is similar to naproxen, but it doesn't make you bleed.
Right.
But you did not end up taking the narcotic pain pill, the hydromorphone.
No. And I did, the soreness, I would say, is kind of more down here.
Yeah, turn towards me. Let's let them see what that looks like. So the soreness is in the area where I think I did maybe the most intense sculpture. Does it come up behind your ears at all?
No.
No. Okay.
No, not really.
How about
mostly the lower neck?
Right up in here. Yeah. How about the nose?
It kind of goes up into the in this area.
Okay.
Lower chin.
From
I stretch it. Yeah.
I remember this one. How about your nose? Are you even aware of the nose, or is that just like lost in the noise at this point?
And no, I'm aware because my nostril on the left side was smaller, and it seems like now I can breathe much better out of that nostril.
Yeah, you had a pretty good septal deviation where the septum was coming into your left nostril, and as a part of improving everything, that's been improved too. So I hope you breathe better. I think you will breathe better.
Yeah, I did. That's a bonus. I wasn't even expecting that. So,
we'll put it on your bill, no problem.
Exactly.
Anything else you want these guys to know about how your first night went?
Nothing other than the fact that I'm very happy I found you, and I'm hoping everything turns out great, and from the way you are describing it, I'm getting very excited. So.
Yeah, we talked right before this. I was telling him I don't see anything that I look at and say, I wish that went a little better. Everything went amazing during surgery, and every indication today, all the nerves look perfect, skin health looks perfect. I do have the hemostatic net. I should talk about that. The hemostatic net, turn towards me one more time, are these sutures that are quilting the surface down, and turn the opposite direction as far as you can to turn your whole self and face the cabinets. So what they're doing is they are quilting anywhere they lifted up skin. They're quilting the surface down to the foundation. Turn back this way. I do that in all men, and I do it in women who are very oozy during surgery because it helps prevent the sudden leak springing and blood collecting and the need for emergency surgery. Do they hurt? Are you aware of those stitches?
That's kind of where the soreness is.
Yeah. So I think that's a little bit of coincidental. That's where the deep work was, which creates the soreness. So even the people that don't have the sutures report the soreness mostly here. So they by themselves don't add any additional discomfort, but they're a huge safety net. The other time I often use them is if someone's blood pressure is high and we're fighting it a little bit, because that's one of the bigger risk factors for that kind of hematoma forming, and yours are the same. So I use it in all men, and I use them in women who are just acting risky. They're real oozy during surgery, their blood pressure is combating us. We take them out on the second day, sometimes the third day. They don't leave any marks, they don't hurt, but since that technique has become available, our risk of going back to the operating room for emergency draining of blood has gone down to basically zero. So I forgot that I wanted to mention those. There's you have lots of special stuff. You have the transposition, you have the support suture, you have the net sutures, but none of these did I come up with on the spot. But you want a surgeon that's got a deep toolbox, and can identify this has this particular risk, or we don't have what we normally do, or we want to ward off evil spirits and can reach into that deep toolbox and pull out things.
Or just do something that wouldn't have worked as well because it wasn't in the toolbox.
Right. Exactly
Yeah.
right.
That's what I wanted. Someone who had those kind of skills.
Well, anyway, thank you for allowing people to follow along with you, and I'm so happy for you and a little bit jealous. Today was a big day. Actually, let's back up. Gary, 3 days ago, had a really nice neck lift. I am very jealous of your neck.
My neck, I had the bands, the neck bands, and the kind of the skin hanging down, and it was something I disliked immensely. And now it's all smooth and tight, and it's unbelievable. It's just incredible.
Yeah. He also had what I have, which is kind of low-hanging glands down here. And now
Yeah. And I had the jowls on my jawline, which, just is. It's such a giveaway sign of your age. So now I have my jawline back, nice, smooth, straight jaw.
Yeah. So neck lift, lower facelift.
Mm-hmm.
We did a little bit of a brow lift so that you wouldn't end up looking angry on the top
Right.
and refreshed on the bottom.
Right. So I gave Dr. Nyack the whole palette to work with. I didn't stop here. So,
Yeah. We did under eyes, recycling his fat bags into his hollows. And we left the upper lids, again, because I think on
Yes.
men that can be actually a really good look, to have a little bit of seniority, gravitas left in your face.
Yeah, I didn't want that real tight upper eyelid look. I didn't think that would look good on me. So that was actually Dr. Nyack's suggestion. And as soon as I heard that, it's like, yes, that's when you deal with the eyes, that's what I was afraid of, just having something come out weird on my eyes. And he suggested that, and it was as soon as he said that, I was like, yeah, that's it. That's perfect.
Yeah, it's a mutual decision.
Mm-hmm.
But today we got your net sutures out.
Yes.
And so Gary is 70, which you will look younger than I am after this is done. Like within a week, you're gonna be my younger brother. But with all men, we put netting sutures in to minimize the chance of bleeding the first couple days. And Gary actually did have a little bit of high blood pressure events, which is just not related to surgery. Just people get it for no good reason. Even young women get it for no good reason. But I will say, with age, it tends to be a little more increasingly prominent.
I've only gotten it lately,
prevalent.
so lately in life.
And that net has prevented bleeding, so it's done its job.
Yeah.
We got rid of it today. How is that coming out?
I didn't really feel much at all. It was not an issue whatsoever.
Yeah. We talked a little bit about his career.
I mean, it's nice to have it out, but it didn't hurt or anything like that. So
good.
Yeah.
Fantastic. And then we also did Gary's nose.
Yes.
So tell me about that. What was the impetus behind that?
Well, I had a very long nose, and it went off to one side, my left side, and my thought was if I'm kind of raising up the face, my neck or my nose could actually come out longer, and appear longer. And so I thought, well, as long as I'm doing this, why don't I do the rhinoplasty too and get it straightened out and shortened just a little bit, and then it would go along with the rest of my face.
Yeah, his profile, again, I'm going to be jealous of that too. Your profile is going to be very masculine, stately.
I like that.
Put together.
Stately is good.
Yeah, it's going to flow really, really, really well.
Yeah.
Let's actually give him a sneak peek. Turn your whole self.
The other thing is the left nostril, since my nose was turned like this, the left nostril was smaller, and now it's all opened up, and it feels a lot better breathing wise.
Yeah. If you can breathe now, it'll be incredible. Tell me, do you know anyone that's been through any of this stuff before? This is something I meant to ask you and I never did. Do you have other friends or family members? Okay.
No one I know. No, I'm the first. I'm the only one. Yeah.
Yeah. Had you watched any of my video interviews with other people?
Oh, absolutely. I watched everything on your website many times.
Okay.
Yeah.
Okay. And so was that?
That's how I kind of gained more knowledge about it. Was looking all through your website, watching your videos, and then kind of thinking about it.
Okay.
Yeah.
Cool. Well, I want to give them a sneak preview. Turn your whole self towards the wall.
Okay.
There. This is what I'm talking about when I'm saying Gary's going to have a nicer nose, nicer jawline, and nicer neckline at 70 than I do at all going on 54. But you know what? You will have earned it because you had, come on back, turn this way.
Okay.
You had the courage to do all this stuff.
Yep.
Obviously, financial commitment, the health to be healthy enough to do all this stuff.
Yep.
Yeah.
And that was one of my thoughts, is that for this last period of my life, however long it is, and hopefully it is that long, I thought this would be kind of a way to bring a little magic into my life.
Yeah.
That's the way I thought of it. This would be absolutely magical.
You are going to have 20 years plus of that magic and that enjoyment and being restored. So I'm really happy for you.
Yeah, I'm so glad to have done this. And as far as you mentioned, the courage part of it, and that is all about, the doctor you choose. And I just had the utmost trust in you.
Thank you.
That's why that's what gives you the courage.
It is day 5 with Gary. How you doing?
Good, very good, thank you.
Good. So just to recap, Gary's 70, and 5 days ago I did a neck lift, deep plane facelift, lower blepharoplasty with fat transposition because you're so lean. Conservative, male appropriate brow lift, rhinoplasty. So we're day 5. How's the week? It was over the weekend. How's your weekend?
Very good, very good. Yeah, and I'm just, I'm amazed at my neck and profile. My neck skin used to kind of go down at an angle from my chin to my throat area, so it wasn't up. It was kind of hanging down at an angle, and now it's completely up and smooth under my jaw and chin, and it's back up where it should be, and it's smooth and it's tight, and it's just incredible. And then on my face was sort of caving in. There were concave areas in the front of my face, and it was beginning to hang down, and I had the jowls. So I completely have my jawline back. The jowls are gone. The front of my face is filled out and smooth now, instead of kind of caving in and drooping down. So it's just incredible. I'm amazed.
You're doing great.
Yeah.
As you know, a lot of the fullness of the front of the face now is swelling. Some of it's where we don't want it. Little bulges of swelling above those little anchor points. So we'll see where all that lands.
Yep.
I had some stitches in the corners of the eye because his lower lid was weak. And not weak enough to surgically do something to, but physical therapy wise, I had the lower lids splinted up to the upper lids with the little corner stitch, and we got rid of those today.
Very happy to get rid of those.
Yeah, they can be irritating, but when I do use them, they're called a temporary temporal tarsorrhaphy, meaning temporary instead of permanent. Temporal meaning the outside corner, not the nasal inside corner, and tarsorrhaphy means securing together the edges of the lid. When I do use them, they're for a good reason, and they have served their purpose, and I got with them, so that's good.
Yeah, and then I also had the sutures taken out in the upper forehead area.
Yeah, the Browlift sutures, that's right. Thank you for reminding me, I'd forgotten about that.
So yeah, little by little, and then every time I come back, I get more stuff out.
Yeah, so day after tomorrow will be the 7th day. We'll get rid of these anchor stitches, do an initial unveiling of the nose. When we first take your splint off, you'll feel like your nose looks fat on the front view.
Right.
But you'll see a profile improvement from where you started.
I can kind of see it already, but I can kind of imagine under the splint what it looks like. But
your nose was where mine will probably be in the future because it.
Your nose was never as long as mine. I really had a long nose.
Well, mine in the future, because what happens is it's already a little bit droopy, and as you get older, it tends to droop more.
Yes, mine did.
People will often say your nose grows as you age. There is some bulk, but a lot of it's just the drooping phenomenon. Yep. So you'll see that improvement right away.
Oh, absolutely. I already see it just under the splint.
Good.
So,
where are you staying? You'll be long gone by the time I put this video. Don't worry, they won't come stalk you.
I am staying at the Marriott Residence Inn. Is it Cook County or?
It could be Clayton or it could be DePere. Daylight Drive. Are you on Daylight Drive?
Daylight Drive.
You started the
Yes.
DePere one. Have they been good to you?
Oh yeah, I've got a suite with a kitchenette, I've got an outer room and I have a bedroom. So up until last night, I had 24-hour nursing service that helped me with everything. And they stayed in the outer room and I slept in the bedroom, and I've got the little kitchenette there, so I'm all set.
Yeah, that's why we recommend either that one or its sister hotel, which is in Clayton.
Yeah.
Because you have that kind of expanded living arrangement.
Yeah. No,
well, thank you.
It's worked out real well. So
good.
Yeah.
Well, I'm excited. I can't wait to see every. Like I said, every day's like Christmas for me.
Every day's like Christmas.
Gary
Absolutely.
come along, and thank you for letting me follow along with you. You're
absolutely glad to do it.
Incredibly generous. Thank you.
Thank you, doctor.
You're welcome. It has been 1 week with Gary. How are you?
Good. Very good.
So just as a recap, neck is what brought Gary in. He is 70 years old. Start with his neck, float up into the lower face, into the brow, under eyes with fat transposition, under eye laser, and a rhinoplasty.
And rhinoplasty.
And you got to see your nose for the first time just now.
So I was able to see the results from the neck and the lower face pretty much right away after the surgery. I could see how great it was. So, and the upper face too, with the forehead and the brow lift and the smoothing of the forehead and the brows up. But today, for the first time, I'm seeing the mid face. This is the first time I've seen the nose, and it's unbelievable. You know, I've always had a long, pointy nose that went off to one direction, and now I have this really nice, straight, masculine, I think you called it, nose that just looks fantastic, and it just fits everything else so well.
No, thank you.
Yeah.
You know, every single patient, sometimes people ask is different between men and women. The answer is yes and no, because every patient you want to build it to what it looks right on them. And obviously certain things like a little scoopy flippy nose would not look right on a...
No.
Are you 6 feet tall?
I used to be. I think I'm 5'11" now.
Yeah.
Yeah.
So 5'11" guy, you can't have a little scoopy flippy inconsequential nose on. But you also don't want, you know, what I have and what you had a little more of, which is the bump and the droopiness. And mine's going to age like that too. And I'll probably have mine. I'll find a guy.
You'll
have
find
it,
a
have
guy.
it reset. But it really is part of the overall complement of what we do to make things look right. So I think that's going to add 30% to your overall result.
I agree. If I would have done all this and left my old nose, I would have been very disappointed. I would have loved my face and my neck and gone, oh, why didn't I do the nose?
You know,
because now the nose goes along with everything. I mean, it's like you know, like painting a picture and then you just left out a spot if we hadn't done everything.
Well, and it's a focal point too.
Yeah.
Obviously.
Oh, absolutely.
Yeah.
Yeah.
You know, turn that way, Gary. I'm going to let him see your other side, just so we don't get accused
Towards
of.
the wall?
Yeah, just so we
Okay.
don't get accused of only showing your good side.
Okay.
He was saying a minute ago, he used to be concerned. All right, turn back to me.
Yeah.
He used to be concerned about which
I
side
always
you
wanted
faced.
to be shown on my right side because my nose turned to the left, and I didn't like that side. So I always, you know, like if you have a date, you know, you'd sit down your right side. So yeah, now I don't care.
You have two good sides now.
I got two good sides.
Tomorrow is his 8th day. We're going to laser the bruising under his eyes and the bruising around the corners of the mouth and help that pass a little bit. Have you had any of the manual lymphatic drainage treatments yet?
Yes, I had the MLT massage.
Yes.
Oh, I had one this morning. It was wonderful.
So that's
Kim.
Yeah, it's Kim.
Yeah.
So that's a specially trained esthetician that we have that helps. We started about a week after surgery. Usually if people are coming into town, they get a couple sessions before they go home on day 10. And it starts help get some of the fluid moving. We don't do it before a week because things are too delicate. On our patients that are then, if they're in town, we can do more of them here, but most of them are going back home, and we recommend they continue them every few weeks at home if they're up to it with the local professional. Diet. What have you been doing for diet?
Well, I've been at the Marriott, and I have a suite with a little kitchenette. So I went shopping before the day before the surgery when I got here, and then also I had one of my nurses who was nice. She went to the store for me and bought chicken and salmon and rice and mashed potatoes, bananas, peanut butter, applesauce. So it's been bland, but it's been fine. I mean, I've been eating very well.
Yeah, that's great. So nutritional, variety,
Yep.
fantastic.
Yep.
The reason he mentioned bland is he had pretty good overgrown salivary glands in the neck, and part of getting this jawline shape that was really, I think, one of your main focuses
Absolutely.
was revealing the bottom edge of the jawbone by debulking the excess portion. We want to put the glands on rest for the first 10 days or so. So anything that would hurt the inside of your mouth if you had a cold sore or a cut, spicy, sour, salty, we avoid, or crumbly, dry stuff, we avoid for 10 days. So everything you've described, salmon, chicken, rice, bananas, none of that would irritate a cut on the inside of your mouth. None of that would get trapped on the, so that's perfect. You're doing the right thing.
Yeah, and honestly, your focus when you're doing this, you're totally focused on trying to get the best results. So you're not really thinking like, I really miss, some meal that you're used to. You're fine. As long as you're eating well and filling yourself up, you're just not focused on it.
Yeah, I think that's a good point. You actually do need the calories. You do need, it's not just protein.
Yeah,
Like
you want to make
eat.
sure you feel good, but
You do need to eat.
you're not really concerned with missing some favorite meal.
Yeah. One more question before I let you go for today. What are you doing with your time? That's one of the hardest things I think people, when they're here, stuck. Gary came in not from super far away, but he doesn't live here either. What do you do with your time, especially now that your nursing service had left you alone?
The first 4 days I had round-the-clock nursing service, and honestly, I just stayed in the hotel room because the regime was, every 2 hours there's things to do. So I just let them do their job and focused on, trying to get rest and follow all the things you're supposed to do. Just in the last couple of days in the afternoons, I've been Googling or, Google Maps, different parks and gone out and just got some fresh air, walked the trails in the afternoon, between lunch and dinner, and just got out a little bit, and it's been fine. And then I'm back in the hotel room for the evening.
Good.
Yeah.
Well, your attitude's incredible. I'm so grateful you're
My
sharing with
attitude is
everybody.
good because I'm so happy.
You were happy to start with.
Yes.
Anything else you'd like to tell us?
Well, I wasn't that happy
today. Well, you have every reason.
If you see the before pictures, you'll see why.
I'll stick them on there.
Yeah.
Anything else you want to know before I let you go?
Nope, I think I'm good.
You're my hero. You're amazing.
I so
Thank
appreciate it, Doctor.
Oh my God.
Yeah.
You're amazing. Thank you.
Thank you.
We are day 9 with Gary. How are you?
Hello, I'm good.
Good.
Very good.
So just as a recap, Gary, how old are you?
I am 70.
70 years old, and 9 days ago we did his deep neck lift, deep plane extended facelift, lower lids of fat transposition, subtle conservative brow lift, and a touch of a rhinoplasty.
Yes.
So how are you feeling about how things are going?
Oh, unbelievable. I love it. Saw the results from the neck lift, right away from the time I woke up from surgery practically. So this is all tight and smooth now under my jaw and chin, and I no longer have the jowls on my jawline from my facelift, and my face is more filled out and smooth. I had kind of these concave areas or areas that were sinking in, so that's all nice and filled out. And then on the brow, my eyebrows were down, as Dr. Nyack pointed out when I first sent him photos, were practically resting on my top eyelids, and now that's been raised up, and my forehead is nice and smooth, and the lines in my forehead are much, much, much better. And then just 2 days ago, which I hadn't seen yet, because I had the splint on my nose, I saw my nose for the first time, which is just amazing. I had a long pointy nose, and it kind of went off to one side. And so Dr. Nyack slightly shortened my nose and straightened it. So, it's the kind of nose I wished I had my whole life. It's a cool nose. It's kind of got this squarish tip on it, like just the kind of nose I always wanted, and it's nice and straight. So
And you can breathe.
and I was telling him in the hotel room, if you put the mirror just right on the bathroom door, you can see your profile over inside in the bathroom mirror. And so now over the past couple of days, I've been looking at my profile of my nose and my nice, tight, smooth neck. And it's just like, wow, look at that. It's just incredible.
Well, it fits your energy.
Yeah.
100%. So, and you're breathing a little better too.
Oh, absolutely. I mean, because my left nostril, since my nose kind of turned a little bit, my left nostril's always been kind of a little bit closed off. So I'm breathing much better.
Yeah.
I can feel the air going up so much easier.
Well, at 9 days, obviously, we're not still fully healed. I tell people to expect 2 to 3 weeks to be presentable. So I don't think you're presentable yet.
Yeah, no, I still got I did the under eyelids because I had the bags under my eyes. So, I still got the puffiness there. And, but yeah, as soon as that kind of comes down a little bit and a little bit of the bruising goes away, then I can, gradually start getting out again. And then, from what I understand, the lower eyelids, they take really 2 or 3 months to kind of really see the full result.
Yes, so he's pretty puffy. So again, passable at 2 or 3 weeks, final results at 2 or 3 months. And your eyelids are going to be a little puffier than most because I had to do them that special way. And we're having you do some eyelid exercises, some physical therapy eyelid exercises. He had a little bit of a weak lower lid, which we supported during the initial healing process with some stitches that were a little bit irritating. We got rid of those. There's another way you can support lower lids from the inside that really, really shores up the outer corner, but I think it would have been identity changing to a degree on you to do a kind of a cantopexy or cantoplasty, even more so.
Yeah.
So we did something else a little more conservative, and you're doing physical therapy eyelid exercises.
I am.
You want to tell them what those are?
Okay, first I've got the lifting of the lower eyelids with the full cheek behind it, like this.
Yeah, he's closing his eyelids so that as he does it, his lower lids rise up.
So I'm using these muscles, the whole cheek and lower eyelid muscles, to push up. So I do those on the hour. And then I take 2 fingers and I push the skin kind of from the outer corner of the eye up to the inner corner. Push up like this and kind of stretch that skin. Hold for about 5 seconds. And then, repeat that several times.
Yeah, so he's doing active and passive strength. Stretching is the passive part, and then active is strengthening of the muscle that holds the eyelid up. And that between the little support suture and this physical therapy, we're getting away, even if you had a weaker lower lid, you have your exact original eyelid position. It won't look changed in one way and it won't look changed in the other way. But your bags will be dramatically better. So
that's good. I didn't want to change, how because your eyes is really how you look.
2 things that are also specific to men facelift recoveries. One is when you shave, the skin's a little numb where we work, so you might make yourself not feel it. And then 2, this won't apply to Gary as much, it wouldn't apply to me, but guys with pretty heavy beard hair, when we do that lift, some beard hair can end up behind the earlobe, and they'll notice that they have a new area to shave that they didn't have to shave.
Yeah, I don't really have a heavy beard in that area, so it's mostly my mouth and chin, but so I don't have that issue.
That won't be a concern. Yeah. Well, Gary has been so nice to be present for all these interviews, and he's coming back, I know, around the 3 or 4 month mark.
I'm gonna come back around the 3 or 4 month mark and show you guys how everything's gone, when I'm much more fully healed.
Thus far.
Yeah.
Well, anything else we should say today? Or I just want to say I'm sorry. I thumped the microphone.
Don't touch the mic.
Gary's a video professional.
Right.
I just want to say thank you for being so generous with your story and your thoughts and your face. For God's, I'm just so grateful.
Well, I'm so grateful for everything you've done. It's just incredible. Every day I look now and go, unbelievable. It's just unbelievable. So it's just going to be so much fun going forward from here to live this way.
Yeah.
Yeah.
25 more years easy of
Yeah.
just feeling good about
Feeling
not
good.
having to worry, feeling
Yeah.
good. Congratulations, my friend.
Thank you.
You're amazing.
Appreciate it.
You're welcome.
I hope you found this information helpful. If you did, hit that subscribe button and turn on the notification bell icon so you can see my future content.